More than a dozen Franciscan St. Elizabeth Health employees may lose their jobs later this year. Health officials say it's all part of a consolidation move that will save millions of dollars a year.
When we're finished with this, there'll be fewer people employed here. There's just no other way to address it. Exactly how many, I don't know.
There are still a number of unknowns about consolidation plans announced Tuesday by Franciscan St. Elizabeth Health. What is known is that the emergency room sign here at St. Elizabeth Central will be taken down. In its place will be an urgent care facility that will be open 8 to 12 hours a day.
Many of the visits in this emergency room are urgent care level visits. And that's one of the things that helped us make that decision.
Though the nearest ER for West Lafayette and downtown Lafayette residents is now on the far east side of town, CEO Terry Wilson says critically injured residents are still just as safe. In fact, the most critically injured haven't been sent to the Central campus for some time.
The key time period is how long it takes them to get to you, and that hasn't changed.
The ER is not the only consolidation targeted for September 1st. 2 acute medical units and the intensive care unit are moving from the Central campus to the east. Wilson says it's a move that was designed to happen when the East Campus opened in February 2010, but there weren't enough beds at the time. The space is now available because of several factors, including a push by insurance companies to cut expenses and length of hospital stays.
A lot of pressure on how long people stay in the hospital. Well, that creates capacity, creates inpatient capacity in any hospital.
Wilson says on average, 28 people are in the units that are moving. The capacity is 99. It's part of the reason he says it will save millions of dollars every year, though exact totals are still an unknown.
None of this has to do with the quality of the service or the care that they provide. It's outstanding, and we're grateful for their commitment to the patients we serve here.
Multiple task forces have been formed to determine how best to configure what's left of the Central campus, which includes a psychiatric unit, a rehab unit, and a long-term acute care hospital run by an outside group.
In all likelihood, there will be parts of this facility that are vacant as a result of that planning, and we just don't know yet what those might be.
So that's another unknown. Again, the target date for the consolidation is September 1st. There are more than 1,900 employees at both hospitals, home care, and nursing school, many who work at both campuses. Terry Wilson says performance, seniority, and skill sets will all be factors in which employees are kept and which are laid off. One thing that will remain open at the Central campus is the chapel that has someone praying in it around the clock.